receives blood through the renal artery. It passes through the structural unit of the kidneys. At the nephron, waste and excess water pass out of the blood. The filtrate moves down the ureter and into the urinary bladder. It passes out of the body through the urethra as urine. Urine is formed in the kidneys. It moves down to the ureter, and then it goes into the bladder where it builds up, and then it goes out into the urethra and then externally.
Renal lithiasis, or kidney stones, are made up of acid salts and minerals in the urine that crystallize or stick together to form hard deposits. Kidney stones are formed when there is an imbalance of water, salts, and minerals in the urine.
The different types of kidney stones are calcium stones. These are the most common, and they come in a form of calcium oxalate. We have struvite stones, which are caused by an infection, most likely a UTI, and they're more common in females than they are in males. Then we have uric acid stones, which are formed in people with a high protein diet, people who have a low urine output, or people with gout. Then there's cysteine stones, which are a hereditary disorder, and it causes kidneys to secrete too much cystinuria, which is an amino acid. The symptoms of a kidney stone would be waves of sharp pain in the back and lower abdomen. This is the biggest sign that you may have a kidney stone. Nausea and or vomiting, frequent urination, painful urination, bloody or cloudy urine, and smelly pee. This is the size of an average kidney stone. So the kidney stone is formed in the formed in the kidney. It moves through the kidney down into the ureter. This may be the most painful part because the ureter is a thin tube, and the kidney stone sometimes can make the ureter stretch, and it can cause excruciating pain. It moves down the ureter into the bladder. It may sit here for a while until it is pushed out the urethra and external.
To avoid getting kidney stones, you can drink at least 2.5 liters of water per day. You can eat fewer beets, okra, spinach, Swiss cheese, sweet potatoes, nuts, tea, chocolate, and soy products. Restrict your sodium and animal protein intake, and do not use calcium supplements, but calcium from food is okay. You can get rid of kidney stones by drinking plenty of water, apple cider vinegar, and citrus sodas. Stay away from sodas that are sugary or high in corn syrup. You can also exercise 30 minutes a day to reduce your chances of getting a kidney stone. 15% of kidney stones require intervention with help from a doctor. If a doctor is needed, sound waves can be used to break up kidney stones, or surgical removal using small telescopes and instruments can be inserted through a small incision on the back. Scope removal can also be used.
Most kidney stones are detected through a urinalysis, a blood test, which tests for calcium, phosphate, uric acid, and electrolyte levels. They can be tested through an X-ray, CT scans, or an physical. Here are some not-so-fun facts. Some kidney stones are caused by overactive parathyroid glands. The parathyroid gland is located at the four corners of the thyroid gland near the Adam's apple. If these glands produce too much parathyroid hormone, known as hyperparathyroidism, calcium levels become way too high and they can form kidney stones. Men are at most risk for kidney stones. There is a high recurrence rate, which is about 50%. Depending on the location, they may have different names as well. One of the names is a urolith, which is a kidney stone located in the urinary tract. We also have nephrolith. It can be a kidney stone located anywhere in the kidney. We have ureterolith, which is located in the ureter. And then there's calculus, which can be a kidney stone anywhere in the body. Lith means stone.